Are you okay? I've got you.
Imagine a family member becoming a little more forgetful than usual, a bit more irritable, or occasionally losing their balance. Many people assume these changes are simply part of getting older. However, in some cases, these symptoms can be linked to underlying medical conditions, including problems with blood flow to the brain. Because these changes may have many possible causes, it's important not to ignore them or diagnose them on your own. Today, we are taking a closer look at brain health and how stroke can affect the brain. Most people have heard of the fast warning signs of stroke: face drooping, arm weakness, speech difficulty, time to call emergency services immediately. These signs remain one of the most important ways to recognize a possible stroke. But not every problem involving blood flow to the brain presents exactly the same way. One condition doctors pay close attention to is a transient ischemic attack, or TIA, sometimes called a mini stroke. Even if symptoms disappear, a TIA should always be treated as a medical emergency because it may signal an increased risk of a future stroke. Prompt medical evaluation can help identify the cause and reduce that risk. Some people also learn from brain imaging that they have experienced what doctors sometimes refer to as a silent stroke. These are areas of brain injury that may not have caused obvious symptoms when they occurred. In some cases, they may be associated with subtle changes in memory, thinking, balance, or mood, although these symptoms can also have many other causes. Because these changes are often gradual, they can be overlooked. That's why persistent changes in memory, walking, balance, or behavior should be discussed with a healthcare professional instead of dismissed as normal aging. While not every stroke can be prevented, many risk factors can be reduced through healthy lifestyle habits, including regular physical activity, such as brisk walking if appropriate for your health, managing blood pressure, eating a balanced diet that includes limiting excessive salt intake, avoiding smoking, following your healthcare provider's recommendations for conditions like diabetes, high cholesterol, or heart disease. Taking care of your blood vessels is one important part of protecting long-term brain health. If you or someone around you develops sudden facial drooping, arm weakness, speech difficulty, vision changes, severe dizziness, or other signs of a possible stroke, call your local emergency services immediately. Early treatment can make a significant difference.